1 in every 9 women is diagnosed with breast cancer in Pakistan every year. We really encourage our women to do self-breast examination. So be more active, eat healthy, more vegetables, more fruits, less meat, less sugars, and less fats. First of all, we need to change this perception that cancer is not a death sentence. We have very good success rates, more than 90% in early stages. And if we detect them at stage 0, which is pre-cancer stage, we can actually save 100% of women.
Assalamu alaikum and welcome back to our podcast. My name is Saida Pakiza Hashmi and I will be your host for the day. In today's episode, we will be discussing something that is affecting millions of women across the world, breast cancer. As you know, breast cancer is one of the most common forms of cancer out there. Around 2.2 million women were said to be fighting it at the end of 2020. So to create more awareness and to know more about it, we have with us Dr. Hira Asim, a consultant oncologist at Shifa International Hospital, Islamabad. Dr. Hira will tell us more about the cancer, the risks, and the preventions that we can take. Assalamu alaikum, Dr. Hira. How are you doing?
I'm good. Thank you so much.
Dr. Hira, what do you think about breast cancer awareness? Like there's a whole month dedicated to just breast cancer.
So as you just introduced, that breast cancer is the most common cancer in the world.
Yeah.
So previously it was lung cancer. Now it is breast cancer, which has actually surpassed lung cancer. It is the most common cancer in women, not only in Pakistan, but all over the world. And as you mentioned, like 2.2 million women, they are diagnosed with breast cancer every year. And out of these 2.2 million women, 6,84,000 women, they die every year. So the numbers are quite huge and the figures are quite alarming. So if you look at the situation in Pakistan, we don't have a very great cancer registry, but still whatever data we have that shows us that around 90,000 women, they are diagnosed with breast cancer every year in Pakistan, and at least 50% of them die every year. So which is quite alarming for us. Like women dying at such a huge rate. And according to a study, 1 in every 9 women is diagnosed with breast cancer in Pakistan every year. So it is such a huge, number, and it is such a deadly disease that it needs awareness. So we should be talking about the causes of it, how can we prevent it. We should be discussing about the screening methods, which we actually are doing now. So I'm so happy to see young girls talking about it, government taking part in conducting seminars. Even private sector is so involved. The media is taking its role in creating awareness. So it is actually very good. I mean, there was a taboo attached with breast cancer initially, and we were not able to talk about it so openly as we are discussing about it now. So it is actually very encouraging that we have started discussing and talking about it. Yeah,
that's true. Even I think I've been part of some seminars as well, like on the receiving ends, and education is very, very important.
True.
But what do you think causes breast cancer? Is there a specific thing that causes it?
So coming to the breast cancer causes, we cannot actually say that this is something that will cause cancer. So all we know are the risk factors.
Right.
So risk factors means that the things that will increase your risk of having breast cancer. So among the risk factors, so there are certain factors which we can actually modify. That means we can work on them and we can actually modify them or change them to reduce our risk of breast cancer. But there are certain factors which are actually non-modifiable. Okay. That if you have them, you have increased risk of breast cancer, but you can do other measures to reduce your risk. So among the modifiable factors, the most important risk factors are like if for girls, if they have periods starting at a very young age, like less than 12 years, women who have menopause above 50 years. So the reason behind is that your total duration of hormonal exposure increases. If you have early menarche and late menopause, so that increases your risk of breast cancer.
Right.
Secondly, women who don't have children, they are at increased risk of breast cancer. Then women who don't breastfeed, they are at increased risk of breast cancer.
Okay.
Then women who use oral contraceptive pills or hormone replacement therapy for a long time, they have increased risk of breast cancer. So it doesn't mean that if you're using oral contraceptive pills or injections or hormonal replacement treatment for a few months, then your risk increases. It's like if they are taking it for at least more than 3 to 4 years. So anything that among these things, if you take them for a long time, then your risk increases for the breast cancer. Then women who have children above the 30 years, they are also increased risk of breast cancer. So pregnancy at an early age is good and is protective against breast cancer. Then women, and generally pregnancy is protected. So women who don't have children, they are at increased risk of breast cancer. So among other factors, there are certain environmental factors like if we are exposed to pollution, if we are smoking, drinking alcohol, which is fortunately less in our country. These are also certain environmental factors that not only increases the risk of breast cancer, but also many other cancers. So women who are overweight and their BMI is not ideal. Ideal BMI we call as between 20 to 25.
Okay.
So if they are overweight, like their BMI is more than 25, they have increased risk of breast cancer. So that means that if you are more sedentary, you are not controlling your diet is not healthy, then it definitely increases your risk of breast cancer and other cancers. And apart from that, there are certain women who have cancers in their family. There are multiple relatives or close relatives. They have cancers. Like if somebody has sister or mother or first cousin who has breast cancer, ovarian cancer, or if somebody has bilateral breast cancer in the family, so these women, they are at increased risk of breast cancer. So this is called genetic risk.
Right.
So their genes, so they have high risk of mutated genes transferred from their other family members to them. So they're also at increased risk. Though the percentage of genetic breast cancers or hereditary breast cancer is low among the total breast cancers, only 5% of the breast cancers, they are genetic. But still, we need to address this specific group as well.
Yeah. So you said oral contraceptive, if you take oral contraceptive, you are exposed for a longer time, you're more exposed to you're more likely to get breast cancer,
true.
right? So there are people who have PCOS. There are women who are struggling with PCOS from a younger age, and they take those oral contraceptive for a very long time to get their periods in order. So what do you think they should do? They cannot stop those medications, right? Because then their periods will not be on time and the whole cycle is off. So they need to take those medicines, but that also means that their exposure or their likeliness of getting cancer is also high. So what would you recommend for those people?
Okay. If they're taking these contraceptive pills for a specific medical condition, then obviously we can't avoid them. And if that is the only treatment, then obviously they will take them. But the thing is that we need to minimize the exposure to these medicines. They shouldn't be taken for an extended period of time. So they need to discuss with their gynecologist that are there any alternate options that can be advised to them, or can they reduce can they minimize the duration they are taking these pills? Because everybody knows, even the gynecologist knows that these pills are harmful. Then there are certain other methods. If we talk about contraception, there are certain other methods apart from oral contraceptive pills that can be offered for the same purpose. So they should discuss with the gynecologist. I'm sure they will be able to offer them the alternatives as well. Yeah.
Okay. So what are the early signs of breast cancers?
So women should be aware of the initial changes in their breast that can that can be one of the sign of the cancer. So we really encourage our women to do self-breast examination. So we recommend that this examination should start after the age of 20 years, and they should do it every month. And this examination should be ideally done after their periods finish, at least 3 to 4 days after the periods. The reason is that this is the time when their breast is less painful, and they will be more comfortable, and they will be able to pick more changes. So when they do self-breast examination, they need to look for the changes, like if there is any change in the size of the breast, like one side is bigger than the other breast. Secondly, if there is any change in the skin, which means that there is redness or any change in the texture of the skin, or the skin is tethered or pulled in. Similarly, if there are any changes in the nipple, including crusting of the nipple or ulceration of the nipple, or bleeding, or any obvious bleeding or discharge from the nipple. Also, if the nipple is pulled in. And they also need to not only examine the breast, but also the area around the breast, which means they also need to examine the axilla or the armpit, and also need to examine the lower part of the neck. So these are actually two areas where the cancer spreads the first. This is the first site where the cancer spreads. So they should be, when they are doing self-breast examination, they also need to look for changes in not only in the breast but also in these areas. So similarly, while examination, if they feel there is anything which is more harder compared to the natural breast, or any part of the breast is hard, or there is any obvious lump that they can feel in any part of the breast, or axilla, or lower part of the neck. So these all could be the signs of cancer. So they need to discuss with their doctor. So it doesn't mean by saying all this that if they have all these changes, it is definite that they have cancer. There are other breast conditions which can lead to lumps, which can lead to skin inflammation, which can lead to ulceration. So it's not necessary that all these changes could always be a cancer, but these changes, yes, they could be initial signs, or even late signs of cancer. So these changes should not be ignored and discussed with your doctor.
You said you should do it once a month.
Yeah.
All of this, and it takes like 10 minutes. Do you think the frequency should increase as the age increases, as you get older?
So, the reason we start advising it at the age of 20 years, though we know that this is not the age generally breast cancer develops. So the reason we recommend is that when women start examining themselves at an early age, they are able to know their normal anatomy, or they're able to know they're normal. They are aware of it. So if there are any changes gradually in their breast, or any changes that we just mentioned, they will be able to pick it very early. So if they don't know they're normal, they won't be able to pick up the changes that are taking place. If they're examining themselves for the first time and they're seeing something, they will definitely get worried. But if there is something there for a long time and it is not changing, and they've already spoken to their doctor about it, and the doctor has said that it is nothing worrying, then obviously they will keep examining, but they will know that this is something they have, but this is not worrying. So the frequency is recommended by the doctors is always 1 month. So we do so much of other things, like so it's not difficult to spare 5 minutes for yourself. We take shower, so you can do your examination while taking shower. You can do your examination while lying down before sleep. So it's not very difficult thing that you're asking from women. So if they take out 5 minutes for themselves every month, it will be good for their health.
Do you think that breast cancer can be prevented?
Yes, we just talked about the risk factors, and we just discussed that there are certain risk factors which are modifiable. So we can definitely work on those factors, which means that women should be more active. So they should watch out their weight. So they should have a healthy BMI. If you are unable to calculate your BMI, it is something which is calculated based on your height and weight. So you can speak to your doctor. They can guide you about your ideal weight. So maintain your ideal weight, eat healthy, which means that eat more of the fruits and vegetables, and reduce the consumption of red meat and obviously sugars and fats, because these are all the things that may increase your weight. So be more active, eat healthy, more vegetables, more fruits, less meat, less sugars, and less fats. So these are all basic changes that you can easily do in your life. Similarly, quit smoking if you're doing, and we know it's a very dangerous habit. So it has multiple carcinogens that not only increase your risk of breast cancer but other cancers, and leads to different other conditions as well apart from cancer. So quit smoking, no other addictions, which fortunately we are lucky that it is not that common in our country. So and then I will encourage women to breastfeed their children. So it is protective. Again, pregnancy is protective. Avoid and reduce the use of oral contraceptive pills as maximum as possible. If you're taking hormonal replacement therapy after menopause, you should discuss it with your doctor so that we can, at least guide you towards the proper precautions or screening methods that you should follow if you're taking these medicines, because if you're taking them for a long time, that increases your risk of breast cancer.
But does breast cancer only happen in women? Can it happen in men?
99% of the breast cancers, they are seen in women. But yes, 1% of the breast cancers, they are present in men as well. So the breast cancer in men is exactly treated in the same way as women, and we do see and treat men for breast cancer.
Well?
In Pakistan as well. Yes.
Very interesting. So we talk about patients who have breast cancer, and we have a lot of material for people who, how to support those patients, people who are going through breast cancer, going through cancer in general. Do you have any advice for the patient support system, their friends and families? Because they're the one who have to help the patient as well. Do you have an advice for them to not lose hope?
Okay, so in our country, in fact, all over the world, cancer. When the word cancer comes, it is like a death sentence for the patient. I mean, even the family and the relatives, they all think that, oh, this lady has got cancer, she will not survive. So I think, first of all, we need to change this perception that cancer is not a death sentence. We treat diseases like diabetes, hypertension, and so many other diseases which are like chronic diseases. We take their medicines for a long, long time and we don't complain, right? Diabetes, hypertension, they are all affecting our organs in the body, heart, kidneys, brain, eyes. But we don't complain about them. We are happy to take the medicines. We keep them in control. But when the word cancer comes, it's like this patient is not going to survive. It's not like that. So the first thing is, we should emphasize that we should have early diagnosis, early detection, and we are able to cure cancer for a very long time and or forever. We have very good success rates, more than 90% in early stages. And if we detect them at stage 0, which is pre-cancer stage, we can actually save 100% of women. So we need to change this perception that cancer is not a death sentence. It is like a disease, like many other diseases. If you are diagnosing it early, yes, we are curing it completely. And if we are even diagnosing it at a late stage, like stage 4, we are giving you medicines which are very effective and which are controlling this disease for a very, very long time. I have patients who are on medicines and they are surviving for years and years. So take it like a chronic disease, and don't make it make it a stigmata for yourself and for your patient as well. So apart from that, yes, when a woman is diagnosed with cancer, there are so many issues as well. Especially we know that the treatment is not so easy financially, especially in our part of the world. So they need support in terms of finances as well. And additionally, our women, especially those living in far countryside, so they have limited access to the hospitals. So they need their family support to bring them to the hospital at the right time, to get their treatment completed, to follow the advice. So most of our women, they are dependent on men in their family. So it is the responsibility of the men that they should take proper care of the women at their house, and should properly provide them with health care. So if they have to go them for follow-ups, they should be able to take them regularly, and they should follow the advice of the doctor. So we do see negligence on part of other family members, that then I mean, if there is negligence in the treatment, definitely they come with complications, which are even harder to treat. And then, the worst part we have seen in our country is that some people have a perception that this patient has a cancer, so it will spread to others in the family. So they completely isolate that person in the family, and they separate their utensils, and which is actually very upsetting. Not only for the patient's health, and it is just the negligence or just lack of awareness that they are doing like this. So they should know that cancer is not contagious. It doesn't spread from one person to another person. So these women, they need to be properly taken care of at home. And they should be able to live their life as normally as the other women are. So these are the important messages I think I would like to convey to the family members who are taking care of these women.
Because I think when you are diagnosed with cancer, it's very easy for you to lose hope and get into that mindset, okay, that's it, I'm done. It's not going to work. And then I think as women, we are so emotionally charged. Then we say that, why should we go through this treatment? It's going to be so expensive financially. And for some reason, we just think we're not worth it. Like, let's not save that money. It's okay, I will die. So I think at that point, when the patient is feeling so emotional about it and losing hope, it's really important for the family members around them, like their spouses, their parents, their children, or whoever they're living, to kind of emotionally support them, to encourage them to go for these treatments. And I think if you have a friend who is thinking she felt something, if you have a friend telling you that she felt something and she's scared, she doesn't want to go to the doctor because for some reason, if they don't go, it will magically go away. I think you should encourage them to go to the doctor, at least check kara lo, go for it.
True.
Right?
Yeah, definitely. So I see a lot of young women who are diagnosed with breast cancer. Sometimes women who are newly married, sometimes women who have their first precious pregnancy, sometimes women who are planning to go for marriage, whose marriage is just planned in few months. So you can imagine that in those situations of life, when they get to know this diagnosis, it leaves a very huge psychological trauma. So definitely it is the family who is supposed to support the patient eventually. And then I think it is a huge responsibility of the doctors as well, that when these patients, they come to you, obviously they are in such they are passing through such emotional state that we need to encourage them to we need to give them hope. So I mean, this part should be played by the doctors. So unfortunately, we don't have like those support groups where these women, they can talk to each other, they can talk to other breast cancer survivor and gain that hope. I'm sure we would have them in future, but at the moment, I think the responsibility lies to us, that we need to encourage them, we need to give them hope, we need to tell them that eventually we we will be able to treat them. They will be able to complete their treatment and eventually carry on with their normal life. So there are many patients of mine who are married after cancer treatment, who get married after cancer treatment, then who get pregnant after cancer treatment, and who complete their families after cancer treatment. So we need to actually give them knowledge to these women so that they can keep their hope alive.
So how often do you think someone should go for screening?
Okay, so we just talked about self-breast examination, and we said that it should start at the age of 20 years.
Yeah.
So it is a World Health Organization recommendation that a woman who is above 40 should go for a yearly mammogram. So mammogram is a simple X-ray test that is done once every year for women who are above 40 years. So for me, like, we are a resource restricted country. So generally I recommend my patients that if you are going for a mammogram and you find it is normal, and based on your doctor advice, you can do it every 2 to 3 years as well if your first mammogram is normal. But ideal is, yes, if you can manage to go every year and do a mammogram, that should be ideal. But if you're unable to do it for some reason, it doesn't mean that you should completely don't do it. Just do it once, less frequent, once every 2 to 3 years. So I do see patients in clinic who come to me, and when I ask them, did they do a mammogram, they tell me, yes, we did it. And then I ask them, when did you do it? And they tell me they did it 10 years back. So they should understand that this is not a test that is done like this once in a while. It is a test that should be regular, either once a year, or if you cannot manage to do once a year, at least once every 2 years or 3 years, it should be done. So then for women who have increased risk of breast cancer, like we discussed the risk factors in detail. So I'm talking about the women who have increased genetic risk, means whose family members have a tendency to have breast cancer, or somebody in the close family relatives have breast cancer at a younger age, or bilateral breast cancer, if some male member of the family has breast cancer. So these are the women who have high genetic risk of developing breast cancer or ovarian cancer or few other cancers. So these women should go for genetic test. So generally we like to do that test for women who is affected by breast cancer, and once we find the genetic mutation, we advise the genetic screening to other family members as well. So for women who are found at a higher genetic risk based on their positive genetic test result, we offer them more intensive screening. That is, we do mammogram more frequently, and we also advise them other tests apart from mammogram, including ultrasound and MR. So mammogram is a test that can only give us a good information about 40 years. So if we do it before 40 years, yes, it can give us some information, but not as good as above 40 years because of the texture of your breast in that age. So we add some other tests like ultrasound and MR mammography that gives us more information. So if you have increased risk, or if you have somebody in your close family has breast cancer at a younger age, or bilateral breast cancer, you should speak to your doctor according to your so they will recommend you screening recommendations according to your risk assessment.
But is mammogram painful?
Okay, so mammogram is a test. We discussed it is an X-ray, just like a chest X-ray. But yes, so it is a test in which breast is compressed between the two plates. Yeah. So yes, women find it quite painful, and there are many women who when do it once, they tend to refuse it later on. So yes, it is a bit uncomfortable. So I do counsel them that we should be strong and we should be able to bear the pain. But sometimes I do advise them to take some pain medicines before they go for the test. And then for younger women who have their periods ongoing or premenopausal, they can have this test just after their periods finish, because at that time they will feel less pain. And women who are postmenopausal, they can go at any time. But yes, all we need is counseling, that this pain is not gonna not gonna damage that breast.
Yeah.
So we need to, inculcate this message into their minds that this pain is temporary, and it will go away once the test is done, and it is not gonna harm you. So we need to just bear with it for our best health in the future. Yeah.
Okay. Thank you so much, Hira, for all of your time and valuable advice. We really appreciate you here at MRS.
Thank you so much, player.
I hope today's video was educational and informative. If you have any other question for Dr. Hira, please go ahead and leave it in the comments below. Her contact information will also be in the description below. As the saying goes, prevention is better than cure. So ladies, take those 10 minutes and examine yourself at least once a month and be safe. Please like our video and subscribe to our channel. Until next time, Allah Hafiz.